Okay, hello and welcome everybody. Welcome to the System Mapping 101 webinar. My name is Lindsay McCrae. I'm the Communications Officer at the Canadian Observatory for Homelessness. I'll be your contact throughout the webinar on all tech matters. So if you have any issues, please send me a message through the question box. Just a few housekeeping things. You can listen to the webinar using your computer speakers or using a headset. And if you have any questions for the presenters, you can use the question box to post them. And then at the end of the webinar, we'll go through the questions and have the presenters answer them as needed. We will be monitoring and responding the questions, so don't worry, we won't miss them. We will also be sending out a link to the recording, so you are able to watch this at a later date, and it will also be posted on the Away Home Canada website. And now I'm going to pass it along to our wonderful presenters.
Hello everyone, and this is Alina Turner. Just wanted to get things going and have everybody introduced as we get into the webinar. And I'm probably the most excited about this webinar because this is a topic I'm really passionate about, but I don't know as much about as other topics. So I'm going to learn along with you as well. So we're going to go through the presentation with myself, giving you an overview of system mapping, at least my take on system mapping at this point in my understanding of it. And then I'm going to pass it over to Marty, and Marty leads the social and community development portfolio in the city of Lethbridge, and they're doing some very exciting on-the-ground work that he's going to be sharing with you that has tons of implication for our understanding of system mapping in the homeless serving sector and beyond. And then on to Jennifer Tipple from a City of St. John's and Homelessness St. John's, and she leads the performance management and the system performance work that's happening there. And same thing, excellent work happening on the ground, trying to understand what the system there looks like and how to bring it all together with coordinated access as well. So some really interesting learnings from her. And then David French from Away Home Canada is going to wrap it up and reflect on government and their take on system mapping and how it all fits into the broader systems integration conversations we've been having as part of our learning series. So without further ado, I'll get into my slides, and please keep the questions coming. We're active on social media, and we're going to be answering your questions at during the question period that we have set aside for this. So first things first, what are we talking about when we're saying system mapping? And of course, just like many things in our field, there's not this one definition. So this is an initial stab at explaining it in lay terms. But from our perspective, at least, it's an essential first step in any effort that takes a system planning approach to complex issues, including homelessness, but not limited to, as you'll hear from other presenters as well. So it evolves from this idea that we need to understand what it is exactly that we're trying to shift in our community. And so to do that, you need to understand what resources you have in your community. And to find the resources, obviously, you're going to need to do some interesting digging around to categorize, to actually inventory, and to figure out exactly what that analysis is telling you about what your community's assets and resources are and where you need to go from there. So there you go. It involves a methodical finding, categorizing, and analyzing of social assets and resources operating in your community. I want to break down this idea of social assets and resources because just like many other pieces of work in our world, things are not always what they seem. So what might look like a homeless serving system program, when you actually go in further and look at the program components and how they fit in the broader system of care, you might find, wow, this program is actually quite essential in the health system or corrections or poverty reduction. So to really understand what your homeless serving system resources are, I'm sorry to tell you, but you're going to need to understand what the whole community and all the resources are in your in your particular region, because they're all interconnected, they all overlap, and the mess sometimes happen within one program or within the same organization. So you can have an organization that operates a Housing First program, but operates that alongside a mental health case management program. So can you really tell the difference, or can you really say that the mental health program has nothing to do with the homeless target population, and vice versa, that your Housing First program doesn't play in the health and mental health sandbox? And the obvious answer is that no, the system is interlayered, it's complex and interconnected. So for us to say that one's in, that one's out, without fully understanding what we're talking about would be quite erroneous. And I'll tell you more about that as we get into this some more. So this is just a basic overview. So what does it involve when you talk about system mapping? And I've listed a couple of, oops, sorry about that, something fell. I've listed a couple of things that it does involve that I consider must-haves versus must-have later. So it's not that all of these steps or components are not necessary, it's just that there's some that are more upfront work that's needed versus others. So the first thing is an up-to-date resource directory for all the services available to those at risk or homeless in your community. And notice there the at risk / homeless. And when we think about homelessness risk and vulnerability, you can basically assume that any resource in your community that does even things like social inclusion, connecting people to community, even access to recreation for youth. I mean, those are all pieces of the social safety net that are essential for preventing homelessness, versus the services that are right at the ground when somebody actually becomes homeless and is in shelter and sleeping rough. So if we're going to build a system that is not just responding to the crisis, but it actually ties together all the resources to prevent people from becoming homeless, houses them quickly, and then keeps them housed, then you can see that all of these resources in your community become quite important. So it's upfront, you don't want to exclude any without understanding exactly what the full picture looks like for you. And then you can start picking apart what's in, what's out in terms of your target programs in your homeless serving sector. But to do that, you need to understand the full thing first. So I'm not going to, don't flip yet. I wanted to go through this a little bit more, because the next thing you need to do once you know what you've got is you need to start making sense of them. So you need to start categorizing by target population, by geographical scope, service focus, and those are just some of the categories that you need to be looking at. So are there programs that are, for instance, all targeting seniors, but you've got nothing for youth, or you've got very limited programs for certain target populations? What about geographical scope? Is there programs in your community that are oversaturating a particular area in your city, or are there programs that are focused on your urban centers but nothing happening regionally, when you know that migration is a major factor in your demand for services? And then service focus, and this could be anything from, we have tons of services that have an addiction focus, but wow, we've got nothing happening around physical health or accessibility or addictions to particular substances. So all of these pieces you need to tie together, because that's what tells you what you've got to leverage when it comes to ending and preventing homelessness in your community, right? So the whole point of this, and if you remember what Housing First is all about, is that case managers are meant to be navigators that are connecting people to the right services and community. We're not meant to keep people forever in our system. We're meant to have a quick intervention, well, relatively quick, right? Sometimes it's a couple years or so, but our whole point is that we're going to connect people to resources and help them get included and integrated back in their community, because that's where we feel that people are going to do best, versus the homeless serving system. So I think we can all agree that that's the ideal, but to do that, we're going to necessarily need to tap into those services that are out there beyond the homeless serving sector. So beyond this, the mapping of locations to understand location patterns, I mentioned how important this is as well. the real-time occupancy report to know exactly what kind of capacity you have in services. And now we do a fantastic job, I don't want to say micromanaging, but a little bit, micromanaging our homeless serving system, especially if you're a funder. You know, you're very familiar with HMIS and the promise of HMIS to give you real-time occupancy so that you know exactly how much space you have in your funded programs. Unfortunately, you have very little sense of what the rest of the broad ecosystem looks like in terms of capacity and occupancy trends. So you might be overflowing in the homeless serving system, but there might be services out there that are completely empty that you're not tapping into. So you do need to have a sense of this, and I know it's asking a lot, but we do have examples of how you can put this into practice. The eligibility criteria and understanding the access and referral process for people looking for help. And remember, people are often looking for help without your programs. So do you have a clear and transparent pathway for people to get access to what they need when they need it without professional assistance, right? Most people get help from, well, apparently internet and informal networks, not from professionals that are helping them navigate the system. So again, we're talking big picture. How do people find help? How do they stay out of homelessness? How do they manage vulnerabilities before they even become part of the shelter rough sleeper population? The next piece is the feedback loop from clients or users of services to the resources themselves. And this is essential for continuous improvement. It's also essential for transparency in terms of what works. So if the only feedback loop that we have is when the program is reporting back to us from the data, the quantitative aspect, then we're going to be missing some really important feedback from the clients and users themselves. And we've done some excellent work engaging lived experience, but as we all know, there's usually limits to the type of lived experience engagement that we have in our current system. So what you want to do is democratize the feedback loop so that people know that there's a safe space to give positive and negative feedback so that programs get improve over time. And it's not just about our programs that we fund or the homeless serving systems resources, it's about the whole system, right? Because if we see that there's some major defaults happening in some of the ecosystem's components, then we know that this is where we need to tap into our advocacy and our GR work to improve access or improve quality beyond our own system as well. And then of course the performance indicators to track community demand and feedback on services. So this really speaks to taking system planning to the, I have no better word for it right now, but I'm calling it like the ecosystem because it's much more than the homeless serving system. We're a tiny little piece of that bigger ecosystem puzzle that wraps up social supports, health supports, even corrections, like all of that entire social safety net that keeps people doing well in their communities and intervenes when necessary. That's what we're talking about. So it's much more than our system. All right, next slide. So what do you need to capture? And I mentioned here, starting with the homeless serving system, then beyond. So obviously there's some really basic things that you need to know about the resources you have in your community. And some of them are going to be pretty obvious, so basic contact information, the program type, so the categorization that I mentioned, the capacity, occupancy, and now ideally length of stay if it is applicable, right? So not all programs have a length of stay. So for instance, food bank, there you'd just be tracking the entries or interactions. The target populations though, so that you can gain some patterns from there. I mentioned eligibility and prioritization, coordinated access participation. So we do really, really well with, again, our Housing First programs, and maybe starting to get into the supportive housing and bringing that system and social housing on board with coordinated intake or coordinated entry. But, you know, are we leveraging coordinated intake to refer out into the community so that we do diversion and prevention intervention better, right? Acuity assessment tool use. Now, again, this is not to say we need one acuity tool for everyone to use. What we need to do, though, is understand how our partners in the broader ecosystem are understanding acuity and using acuity assessments. And sometimes those tools are going to be very different, and how they prioritize versus how we prioritize is obviously going to make a big difference in terms of our ability to coordinate services for our common clients. The target level of acuity, right? So how are they fitting into our understanding of acuity, but are they traditionally taking folks that are more on the lower side versus high, et cetera? Because that's obviously going to impact who you refer out to them. And there you go, a couple of more occupancy and use patterns that might be interesting for you to think about from a referral basis as well. Obviously, not all of these factors are going to be interesting for all of your resources, but they might be as you get closer and closer to the homeless serving system, because this is where that interaction between these resources and your resources becomes really, really important. The last bullet that I'll emphasize on this slide is the estimated annual funding per program. And this is a really tough one to get your hands on, but it's absolutely, if you're like me, and if you're in the space where you do policy, funding, planning, community plans to end homelessness, etc., and not all of them might be applicable to you, but I'm guessing lots of you are community entities out there or funders of programs. So you're necessarily in the system planning space beyond the program level. And if you are, then you need to know what the resources are that are coming into your community from a funding perspective. So it's absolutely not okay not to know that, and how much of the pie you actually control, how much of the pie you influence, and how effective the pie is in your priorities. You're not going to be able to obviously get everybody to pitch in on ending homelessness, but remember, we are building community plans to end homelessness. We're not building community entity plans or housing first plans to end homelessness. So to end homelessness, we're going to need all of the resources to pitch in for that broader community plan to actually become realized. So that's a plug there around understanding what funding is coming into your community. Next slide, please. If you want to see what something like this could look like for the homeless serving system, and I know it's small writing, but you can zoom into it. And this is just something that I helped the CAEH on a couple years ago that it's actually still really relevant. But you can see how you can create a nice Excel matrix on the various programs within your homeless serving system. Now the trick is, and this is the challenge to all of us, and I'm still figuring it out myself, like I said, is that this works really, really well for your homeless serving system, and it's absolutely the place to start, but that this is not good enough, right? Because this is only a tiny part of the ecosystem, and you need to understand how this piece fits into the broader services. So good place to start, but only a place to start. Next slide, please. So why does this matter? And I mentioned this a few times, and I'll plug it again, but the homeless serving system is only part of this broader social safety net ecosystem. So click a couple more times just to show you. Okay, so we've got the poverty reduction programs that come into play here. So anything on income assistance, but also all of those community economic development programs, or the financial assistance and financial capacity building, debt reduction programs that you might have in your community. That all helps with people that have been rehoused and stabilized, that you're transferring out of your housing first programs, or people that might be at risk, that are struggling with managing debt or financial risk that exposes them to homelessness, of course, right? And keep clicking. Next one is health, justice. These are the ones that we're really, really familiar with, obviously. Children's services, social services, and housing. So health, I think there's one more there, Lindsay. There you go. Okay. So health mental health services, and remember, some of these are operated by your public system, so government entities or your health service boards, etc. But some of them are actually funded by the health system to operate in your community. So they might be like your Canadian Mental Health Association programs, for instance. Justice, same thing. It's your eFRI or John Howard types of programs. Some of them deliver housing first, but some of them deliver direct housing with support services for target clients, but they're actually coming through the corrections or justice part of the ecosystem. So you do need to understand that, especially if you're co-funding or integrating parts of these systems into your coordinated access or coordinated entry, however you choose to use that term. Children's services. So I'm going to pick on my friends at Boys and Girls Clubs because this is a perfect example of this, and this is a Calgary example, but Boys and Girls Clubs in Calgary, one of their primary funders is actually Children's Services to deliver supports for children that might be in care or at vulnerable for child intervention, etc. And they also operate shelter, and they also operate housing first. So if I look at their global programs, majority of their programs, and they're a major player in our youth sector, are actually not funded through Housing First or the Homeless Foundation or HPS Reaching Home dollars or the provincial homelessness dollars. So if I was only looking at those programs, I would only see about 14% of what the resources have that are in current operation. Yet they do so much important work in terms of prevention and intervention for the youth that might be at risk or experiencing homelessness. So I would do a major injustice in not understanding that bigger picture for this agency. And we have a whole sector of these types of agencies in nationally and likely in your community as well. Education, absolutely. And this is, again, where I'm going to draw on my understanding from the education system, actually from my husband, who was a public school teacher. And teachers play an absolute essential role. They recognize risk very early on. They, however, have very little knowledge about where to refer when risk does occur. So they might have some programs within the school, so some of the counselors that might be assigned. They might have some relationships in community with mental health system partners, so that they can make referrals into those systems as well. But generally, they're kind of case managing without resources or knowledge on resources in their community, but absolutely essential when we talk about early intervention, identifying families at risk, because again, teachers come into that day-to-day contact with students that exhibit those risk patterns, and they are a critical piece of the puzzle when we think about ending and preventing homelessness. Social services, again, I'm not going to belabor it because it's a little bit obvious, but think about that, because the programs that we run, I might only be a tiny part of the social services that might be delivered in your community. In Alberta, domestic violence fits within the social service portfolio, and so any of the transitional housing or case management, counseling programs for those fleeing violence are not necessarily delivered through the same stream of funding. So we need to definitely do our due diligence in understanding that. And lastly, housing. And so broadly, housing is obviously your social housing portfolio, your nonprofit housing. And again, those are going to be different, whether they're operated by government or nonprofits in your community. But then there's, of course, the bigger private sector that is operating housing with subsidies that might be coming through your provincial, territorial, or other sources of subsidy. And there might be some interesting pieces that maybe Jennifer will touch on. So for instance, some of the kind of not necessarily informal, but less desirable placements in the private sector that might be sponsored by government resources to get people access to low-cost housing. So anyways, understanding that piece is going to be essential as well, because you can see how it all feeds into the homeless serving system and vice versa, right? So right now, everything's kind of coming in, as you can see from this diagram, But of course, what we want to ensure is that we're pushing back out, right? So if you're familiar with the downloading of responsibility to local communities over time, so this whole idea of neoliberalism in policy and government relationships with community and service providers, that's fine. But now we're at a point where we understand so well that we need to push back up. So we need to upload responsibility and accountability back for pieces that are actually within the purview of these other parts of this of the same ecosystem. We're all working towards the same thing. So next slide. Okay, so an example, for instance, of some of the results of our early system mapping in Calgary, and why it's important to understand the bigger picture. So in Calgary, our Housing First programs, there's 57 of them, and they make up less than 0.5% of the services available to those at risk or experiencing homelessness, and their $1 billion annual budget. So when we actually do our full analysis, you can see there's about 57 Housing First services that are funded through the Homeless Foundation. So that's who participates in coordinated access right now, these 57, which is awesome, major accomplishment, good learnings happening there. But look at the bigger system, the bigger ecosystem. So we have 5,500 that we knew about from the 2-on-1 Calgary service listings. And when we actually did the full system map, we discovered 10,000, and that is not even including our private or informal services. And this is growing every day. We're discovering new services in our community. Some of them are delivered by nonprofits that might have a religious base as well. So, and actually this is kind of where our sector grew out of. So if you look historically where social services were first delivered in the Western world, it was the church. So not surprisingly, there's a huge and long legacy in the faith community to provide supports for people in need. And and lots of people do go to their faith community for assistance, financial assistance, counseling, pastoral care, right? If anybody's familiar with that world, you'll know how important it is to have access to those services when you need them, and what an important role the faith sector plays in this big picture. And I'm not just talking faith church, I'm talking Christian, I'm talking mosques, synagogues, etc. There's tons of services that are being delivered through those entities. And there's of course the Rotary type of, and those types of clubs that are bringing people together with common interests to help mutual aid societies, etc. And again, this is the precursor to unions. Those entities still operate in our communities and serve an important role in preventing and helping people feel included in their community as well. And then of course we've got the traditional nonprofit sector that makes up most of these 10,000, of course, but those are your typical ones, right? Like the ones that we are very familiar with, and I mentioned the Canadian Mental Health Association, your YMCA, your Boys and Girls Clubs, etc. Yeah, so you pick a nonprofit that you're familiar with. Chances are there's an equivalent of that in other communities across the country. But the point of this slide is to show you 57, 10,000. It puts into perspective where we fit in the broader ecosystem and the kinds of resources we can leverage when it comes to preventing and ending homelessness. So when you think about that from a coordinated access model, are we leveraging these 10,000? Do we even know what they are in our community? Next slide, please. And so with that in mind, let's think about your by name list and how it fits with your system map work. So your by name list is basically a giant list. Maybe it's not that giant, but in some communities it's quite giant and growing, but it's the list of your demand, right? It's your demand for services. It tells you what you need. So you've got X amount of people, and you know what their level of reported need might be in that point in time, and you know how to get a hold of them, etc. And your job in coordinated access, of course, is you need to match the people to the resources to meet those needs. That's the basic fundamental function. Like, there's no magic involved. But to do that, you're going to need to have a system map to tell you what's available, right? Because the magic is you need to match demand with available resources. So I would say the system map would be the back end to your by name list, because honestly, without that, you're just going to have a giant list, right, of people that are looking for help. And if you're only leveraging, can you flip back to the previous slide? So if you're only leveraging 57 services to match all the people with services only within that tiny 0.5% of the system, then guess what? You're going to plug up your tiny little system pretty quickly. And I'm sure some of you are already struggling with this, where you can really clog that because we're not referring out. The other thing that's happening, and if you're not leveraging what's out there, is that your case managers become the be-all, end-all for everything in the ecosystem. So rather than your case managers hooking people up with mental health specialists or addiction specialists or whatever's happening, or the food bank, etc., your case managers become the de facto mental health specialist, addiction specialist, health specialist, and you're going to burn them out, and you're going to not leverage the excellent work that's already happening out there and integrating people back into community, which is what we all want, because we want people to move out of the homeless serving system. So keep flipping, and I think I might be done after this. Oh no, I have one more slide. So the step-by-step. So just to summarize my piece, and again, this is my step-by-step learning through doing and screwing up. So you can totally correct me, and this is a living body of learning. So we welcome everybody's feedback. But the first step that I would say is to find all the resource lists in your community. Like, everybody's got one of these, right? It might be your 2-on-1 list. It might be your kind of your referral guide that you might have printed out. Sometimes they're literally one-page, things that everybody might be using in their practice. And don't forget about your public systems, right? Your health system will have their own list. Informal services, the private sector, right? Tons of your counseling is being delivered by private sector counselor and mental health specialists, right? And why is this important? Because when you're low income, there's a fee for service, but there's also counselors that offer supports that are no cost to low income clients, because it's covered by by the basic health plans, right? So just because they're private sector doesn't mean they're not part of the system. They absolutely are. So that's an important resource as well. And with the private sector, we're also seeing people step up and say, you know what, I'm going to run a class or a group for people experiencing addictions, and that's free of cost. Lots of them do this in pro bono. Legal aid, there's tons of lawyers that provide legal aid in kind or on a sliding scale for low income clients as well. So again, we want to ensure that we're looking at this globally. Now, again, don't get overwhelmed. You might just want to start with the nonprofit sector and just work your way out. It's eating the elephant, but one bite at a time, on a type of approach. Then you're going to want to think about how you're going to engage these players to update their information, their list of programs and services in a common database. And you can do this in Excel. We have some fancy ones we can show you as well. But ideally, whatever you have is refreshed and kept up to date, because programs change on the daily, right? Sometimes funding disappears, and yet people are still calling for that service. So you want to ensure that you have a mode of updating these things in real time. You also want to ensure you're not hogging that information, right? Lots of people can help themselves. They don't need a counselor, or they don't need a case manager. Lots of people are like me and you, and we can just look it up ourselves, right? Most people are going to find help without having to tap into our services, and that's what we want them to do. We want to empower them to find their own assistance and make it easy for them to do so. So think about how you want to publicize or ensure that everybody has this list at their fingertips. And then you want to get into the real-time occupancy work and hooking that as much as you can into your coordinated access process so that you can leverage what's out there and relieve pressure on our limited resources as well. Introducing client feedback mechanisms across the ecosystem, using the data to gauge impacts, trends, and develop your strategy and adjustment in real time. Of course, this is a big task, but how is this kind of information going to impact how you do your community plan moving forward and how you manage your system of care? The types of government relations work that you need to do is going to shift once you have this information at your fingertips. And then the last point is to get excited about big data, because if you do this right, you will have big data to help you gauge trends in your ecosystem and do some really interesting work on predicting need and giving guidance on where demand in the ecosystem is moving towards so that you can influence how it all fits together. So I think this is it for me. And I'm going to pass it over to Marty, and he's going to give you a real-time example of this. He's building the plane as he flies it, but it's looking good. So Marty, go on.
Thank you, Alina, for that informative presentation. As Alina mentioned, I'm leading the community social development portfolio for the city of Lethbridge, and I'm going to present my slides more from the perspective of a journey or a story that I'm going to tell on what we're doing in Lethbridge and how this work is kind of impacting our world. And like most communities, we have started out, we need a strategy on how to address our social issues in the city of Lethbridge. We have hit the 100,000 mark as a community, and so we've kind of hit that mark where we're not a tiny city anymore. We can't get away with doing things the way we used to. The bottom line is we have to get better at the way we're achieving our goals, and a key part of that is addressing our social issues and achieving our social policy. So we started out, again, most communities, where we did a study for identifying the dominant social issues and the demographic groups affected, and then a social asset mapping project. And the final piece, of course, would be creating a strategy with those social assets within our community to co-create and co-implement that strategy. And really the picture there on this slide, we all hold an oar to the dragon boat, is critical, because if every one of those people holding an oar is the cluster or group of social assets that are addressing one of those dominant issues, we need to get everybody rowing in the same direction. So, when you identify your top issues as substance abuse or racism and discrimination, poverty and homelessness, not only are they issues in themselves, but they all permeate and network together, and the demographic groups that they impact all hit that same target. So you could have a senior who has a drug and substance abuse problem, who's experiencing poverty, racism, and is also homeless. So it's a real trick to weave all of those pieces together so that as we, as a community, try and address all of those social issues, if we're not rowing in the same direction, if we're not rowing together, we're not going to achieve our overall goals. So next slide, please. So from a Lethbridge context, again, we're a growing community, new and changing pressure points. We were the first community in Alberta to get a safe consumption site, and we are now the busiest safe consumption site in Canada. We're averaging close to 600 visits a day. That's about roughly 200 more visits a day than the in-site safe consumption site, or supervised consumption site, sorry, in Vancouver. So we're a changing city, and we have pressure points, and we now need to really coordinate our assets. And as we started doing our social asset mapping, with the original selfish goal from a City of Lethbridge perspective to say, okay, what are our social assets within the City of Lethbridge? What can they bring to the table to help us address our social issues? And that project started out very organically, but it has evolved and grown significantly. And we know we have about 1,000 social assets in Lethbridge, and I should define social assets being that any group, organization, even individual that is aligning resources to address a specific social issue. And to be able to map and identify all of them, and then drill down to identify the organization, the programs they deliver, the services, what's their strategic plan, to allow us to do a gap analysis of, what are the gaps, what are the strengths, what are the areas of duplication. But the real strategic response there is tying together all of those pieces, leveraging all of those social assets to address the issues within Lethbridge. And it is absolutely amazing, as we started doing this work, how many assets started popping up that we didn't even know about. And the coordination between the groups at first is almost daunting, but the amazing thing is it almost organically happened that, pretty soon a committee was formed, and the whole community kind of rallied around us saying, yeah, we want to get better at working together to address the issues. Next slide, please. So, our approach, again, was the analysis of newly developed an asset map. And we soon realized, as we started mapping everything, we need a platform, we need a database, something to map and track everything we're collecting. And we were looking at, do we develop something internally? Do we look at what's out there? And then, of course, through a number of meetings, we started working with HelpSeeker, which has been huge for us because it's helping us to map, track, and the big thing, I think, the biggest asset is the ability to generate analytics, the analysis part, for us to see exactly what different groups are doing. It's huge. And I'm going to refer back to, and we're not going to go back to this slide, but Alina's slide 7, where she had the circle with the homeless system and then all of the different groups: health, justice, education, housing, social services. Well, if you take that map and you layer the other issues on top of it, like substance abuse, racism, and discrimination, and then connect the demographic groups affected by, such as seniors, youth, minorities, that map becomes very intricate, and it can become very muddy and confusing if you don't have a platform or a database to measure it, control it, and so forth. And so that analysis piece is huge because it helps us to again map and identify where are we duplicating within the community? What are our obvious gaps? So the social network analysis of organizations, again, we did a survey to kind of drill down and get some of that deeper information. The more information you can get and the better quality information you get, the input will help you with your analytics. So all of that information about the programs that they offer. We have organizations here in Lethbridge, and as do all communities, that they may have 10, 20 different programs. We've got a service provider that not only operates our consumption site, but they, of course, do needle distribution. They're a housing first office. They do counseling, they have a recovery program. And so getting into the details of exactly what that service provider is doing is quite important, because it really gives you that deeper vertical on the information that's very valuable to us. And the great thing about it is they're happy to tell you. They want to promote and let people know of all the different things they're doing. And then it's the extensive cross-sectorial engagement and consultation between all the different groups. And again, here is where we found the magic happened, because you get all of those different groups engaging and collaborating, and the relationships are building, and you start to see people start to pull together. You start to see them recognize and realize that they're not the only one that is addressing poverty, and that there's all of these other organizations and resources, social assets, I call them, and it helps them too sometimes with scope creep, because many organizations, nonprofits especially, they'll look, okay, where do we go next, and maybe we should address this. And if they don't know all of the other organizations and what they're doing, they may be going into an area that's already well serviced. And then once you have that map, you do your analysis. It's research in best practice, not only at a local level, but a national, international level. It's about the academic and great research, but it's also all of that stakeholder engagement, drilling into your social assets and what they're doing, and ultimately at the end of the day, by doing their community needs assessment, and then creating that robust social asset map using the systems planning method, and then co-creating that strategic plan with all of your social assets, and then co-implementing it. And then all of a sudden you get that rowboat moving forward very, very fast. Next slide, please. So again, we estimate we have about 1,000 services in our community of 100,000. We just started the process, and so far we have 200 mapped out with data coming in. And again, we have had significant engagement to date. A lot of organizations are asking to be part of this. And it's not just your normal, what we call service providers. We have the Physician Primary Care Network in Lethbridge, which is all of the primary care physicians contacted us and said, this would be an amazing tool for us to leverage, because it helps us to know and understand what are the services out there. We had the local dentist consortium connect with us, because they see a lot of those patients and they know there's many problems beyond their dental work. And the ability to provide and connect with services is amazing. So that overall engagement, it has been, I guess, again, kind of where the magic has happened, where organizations, there's a desire to collaborate. There's a desire to work together to achieve our goals. Next slide, please. So again, this next slide is just a glance of what we're trying to do in Lethbridge, and it's kind of evolved over time, because we started out where we were simply going to review our social policy and create a strategic plan on how best to achieve the goals of our social policy, which would be in the end our Lethbridge social well-being strategy. And our department, Community Social Development, again, where we started out from a singular focus of identifying the dominant social issues and the demographic groups affected. Of course, we knew we wanted to do our Lethbridge social asset mapping, but then that evolved because our council, and the world changes very quickly depending on politics and council, our council decided they wanted to make municipal housing a dominant priority for their new council. And so they created a separate kind of a vertical where they wanted to create a specific housing and homelessness strategy, which is good. And then, as mentioned earlier, Lethbridge has really been impacted by, it's not just the opioid crisis. I always say it's a substance abuse crisis. And so council has sanctioned that we, as a response to a public outcry, that we create a separate, as they're calling it, a community drug strategy. And all of this information is going to help us. How do we allocate our resources effectively to achieve and address those issues? But ultimately, the connecting point on all of that work, again, is leveraging the community, the social assets within the community. The city of Lethbridge may have access to a certain number of millions of dollars to throw at the problems, but we need to leverage the community assets if we're really going to make a dent. Next slide, please. So as we're doing all this muddy, dirty work, very important work, but it again became very clear to us as we're doing our social asset mapping and analysis work that we need a tool, we need a platform and a database that's going to help us bring everything together. And of course, then we started working with HelpSeeker, which has been for us a lifeline. Because it has allowed us to have groups self-populate, and where we need to, we'll drill down a bit to get more information as need be. As Alina said, we're kind of building the plane as we fly it, and so, but we've already had a tremendous uptick in Lethbridge, with the HelpSeeker tool, and it's where we started with the selfish lens that we want this information to be able to see what's out there and where the duplication and gaps are. So it's benefiting us at a government, City of Lethbridge level, but it's also great for the service providers to be able to drill in and see that information. It's also really beneficial for the clients. We have a local tool called Community Links that provides all this information, but it's not in this user-friendly database format. It's literally a booklet that we print and hand out, and it goes out of date virtually the day it gets printed. But to have this real-time live data for the clients to log on to and see is amazing. And then again, for the other services like the primary care network, the dentists, and all of those groups, that can log on and refer and become aware of and connect with all of the services, again, so that we don't duplicate. Next slide, please. So it's making sense of all of those services that we collect. It's not just about mapping and identifying them. It's managing the categories and, creating really whatever category you want. For us, right now, initially, it's about clustering. It's about clustering all of those groups that are providing services or resources relating to poverty or homelessness or drug and substance abuse. And ironically, our city council a week ago, I was brought to City Council on the substance abuse issue, which is front and center in our community. And Council wants answers, and they want them now. And so, their question was, okay, Marty, regarding substance abuse, what resources do we have? Who's doing what? And so having this tool available is incredibly advantageous. And again, having that real-time data is obviously even more beneficial. Next slide, please. So real-time analytics to track service demand by population and service focus. Again, we're building the bridge as we walk on it, but to me, the big winner is that real-time data. and knowing and understanding who's doing what. And it allows us to make better decisions. But again, organically, what's happening, which we hoped would happen, is that collaboration and relationship building between all of the social assets, where they're coming together. They're actually helping pay for our strategic planning process because they believe so strongly that we need to get together to have progress in the issues. And so relationships not only between the big players, the United Ways and the more prominent social assets, but it's the smaller groups. And I'll give you a specific example. We had a church group, and as Alina mentioned, they have a lot of passion. They have sometimes a lot of finances, and this church group was going to provide a variety of different social services. And, because of the process we're going through, we were able to identify exactly what they're doing. It built a relationship between us, the city, that service provider, the church group, and other service providers, where we were able to come together and say, we appreciate the fact that you want to put all of this money into this area, but that's really not where we need it. We need it over here in a different area. And so we're working on a project right now, not with that church group and a number of other service providers, to deliver and build a project in Lethbridge that is in dire need. And I'm seeing that happening throughout the city now, where we're kind of connecting all the dots. And it's happening because of the system mapping and integration piece work that we're doing. And so the indirect real winners out of this work have been the collaboration and the relationship building. Now, don't get me wrong. We will always have challenges getting groups to collaborate. Getting, relationships are always, a challenge to manage. But this tool has helped us at least, see that vision together, and it's promoted helping us work together. Next slide, please. And here is just another example of what could be and what you can do. It's about that real-time data. And again, the analytics behind the scene is where the real power is at. And it's not just for Lethbridge, but it's the region, it's the area. And so another example, I got a call from one of the neighboring towns yesterday from the town manager, saying, hey, I've heard about this asset mapping work you're doing. We would like to do the same in our town. Well, that is so powerful, because not only can we now map what's happening in Lethbridge, but what's happening in the region. What are the services within the region that we can leverage and work together? And so they're looking at providing some services in that town that, at first blush, I'm saying, I don't think you need them. I think we've got that covered, but let's talk. And so again, it's creating that conversation, it's creating the relationships, and ultimately, hopefully, the collaboration, that within a region we can work together, because we know our clients a lot of times in the social system, I'll say, are transient. And so it's important to have that regional connection, and being able to look at the data, from a program lens, from a location lens, to a category lens, and to have all of that analytics behind the scene, to me, is very powerful. So yes, I do get excited about big data. Next slide, please. And then real-time occupancy. This is really would be taking it to the next level. And again, this is an area that we're working on. But to have that real-time system occupancy, to see exactly where we are from an entire system. Now, again, I know this seminar, webinar was focused on the kind of the whole housing homelessness piece, but I'm thinking this can be so much bigger and so much broader because the system or the social issues do not happen in isolation of each other. Poverty does not happen in isolation of homelessness. Substance abuse in Lethbridge is the #1 cause of homelessness. So having that entire real-time system occupancy data available and to start to leverage it, analyze it, is important. And we're doing this in other fields, virtually worldwide. We're collecting and analyzing big data, but not in this world. And I would argue to say this is the most important and pressing issue. It is, for me, obviously, I'm biased, but why aren't we doing this kind of work? Why aren't we putting this kind of effort and dollars into this type of system for social issues when we're willing to do it for everything else? And we literally have lives at stake here. And if we all pull together, and not just Lethbridge in the region, but the different cities, the provincial government, the federal government, and to have this robust, live, real-time, integrated system and platform, I think it's a tremendous opportunity. So that is it for me. Again, this is being kind of we're living it as we're going through this, but it's been very positive, it's been very exciting, and we're really looking forward to it continuing. Thank you.
Thanks, Marty. Hi, everyone. This is Jennifer Tipple, Performance Management Planner with End Homelessness St. John's, based out of the city of St. John's. And I was frantically scribbling notes during Alina's and Marty's presentations as I was thinking of other things to add. So hopefully I can put this all into some coherent thoughts here for you today as we talk about system mapping in St. John's, Newfoundland and Labrador. Next slide, please. So before I begin, I just want to give a shout out to our community and public systems partners here in St. John's and in Newfoundland and Labrador, because we have such a great starting point in terms of, a system mapping perspective. In particular, I'd like to recognize Thrive Community Youth Network. They have the current systems map as it stands, which is a static website listing. It's available online on the website as well as in a PDF, which is actually 251 pages. It's quite the undertaking. It's updated annually and divided into 6 categories, as you can see there: housing, recreation, employment, justice, learning, and health. And I know from working on the front line myself, it's been such a huge resource to frontline organizations to be able to have information at their fingertips and to be able to look up what they need when they have a participant or client sitting in front of them that needs to have something specific in order to address their needs. So that's where we started off as End Homelessness St. John's, when we were looking at our own system map exercise. And what we were really looking at, actually, next slide, please. Oh, there we go. What we were looking at was really a way to build on the success of that system mapping, but also being able to democratize it and move it into the hands of people who would be actually accessing the services. Because one thing that I found in working with participants is usually they may need to, depending on their needs, sit with someone who is in a frontline organization to help them kind of disseminate information, go through what's actually available out there and to see what can meet their needs. Whereas we want to make sure that people who have the most acute needs in the community and people who are even in crisis would be able to find what they need front and center. So we actually integrated it right into our End Homelessness St. John's website, which is currently under development. End Homelessness St. John's, I'm pleased to announce, is finally joining the 21st century and getting its own dedicated website. So we wanted to put this front and center. And in that way, it's right there. Like as soon as you log on, what you see on the screen there is what you would see and it allows the people who would actually need to access the services to see them right there. The system map actually identifies, like it'll geolocate where you are, and then it'll actually let you pick out what you need, whether it's food, shelter, or other kinds of help. And then of course there's a bunch of filters there, ranging from case management to showers and anything and everything in between. So the idea behind this is that you can see on the far right hand side, you can see the more menu, which other people, if they're looking for other types of information on the In Homelessness St. John's website, they would be able to find that. And that'd be things like, how do we access your staff? How do we learn more about the organization? Because, that's something that people that are looking for that kind of information would be comfortable accessing. Whereas the people who need something right front and center, like don't have time or don't have the capacity right now to be scrolling through menus, it's just right there for them. So that was the idea there. And we're also looking forward to integrating with Help Seeker. And the reason for that is, to Alina's point, this homelessness is really only one aspect of the help that people need. Like not everyone necessarily identifies as being homeless or being at risk of homelessness, but people still need help. So we really want to recognize that and also integrate with a national program. Okay, next slide, please. Okay, so Alina, I stole this slide from you. One of my mottos is, beg, borrow, and steal. Don't reinvent the wheel if you don't have to. So thanks for that. Here you'll see a listing of our phase 1 and phase 2 and what we actually have right now and what we will be working toward. So yeah, we have 4 out of the 7 of the elements of a successful systems map right now. I'll just speak to them briefly. Resource directory, I think, is the most tangible one, obviously. And this allows us to really see, as other people have said before me, what's actually out there in the community and whether there are any gaps or duplications, that type of thing. And had a conversation recently with someone in our community about how, there are obviously multiple centers that are offering community meals, say lunch. And we know that some people access lunch at one location and then go down the hill and access lunch at another location. So, why is that? Is that a duplication of services? Well, not necessarily. Should we start looking at the landscape to see, well, are people offering community dinners or suppers? We say supper here in Newfoundland and Labrador. And is that a system gap? Is that something we need to fill? If people feel the need that they want to access 2 community meals in a day, why do they need to be within, say, an hour of each other? So, and then categorization of all programs. I think that's really important just to allow people to drill down because, obviously we've seen from the presentation so far that there is so much information to sift through. So really allowing people to drill down into what they want. Mapping of locations. This is one thing I get really excited about. And of course, it all depends on the ecosystem in which we're operating. In a small city like St. John's, a lot of our services are concentrated in the downtown area or the city center area, which I imagine is quite similar for a lot of cities and towns across the country. And we find that a lot of people that access our services like to be in the downtown. They like to be in the city center, close to the resources that they access on a daily basis. But we also find there are individuals that we work with who do not want to be located in the center of the action because it puts them at risk for exposure to people that have compromised their housing stability in the past, and they've self-identified that they wish to live outside that area in order to kind of keep a distance from the people who might compromise their housing stability. But then does that compromise their housing stability because they don't have the day-to-day access to resources that they need? So we really want to flesh out that system map to see exactly what resources are available to people no matter where they choose to live. And, to also look at things like bus routes, look at things like other forms of transportation that would allow people to live in the place that they want to live, but also have access to the services that they need on a daily basis. And that ties in, of course, to public transit and the rental market, because a lot of people that are outside of the city center that have properties to rent often don't look at our community programs for potential tenants. Now, this is where I'm saying I have notes written all over the place here. I want to make sure I don't miss anything. So Okay. And the other thing I want to say is with regards to the real-time occupancy report, this is kind of, we have it. Actually, can I move to the next slide, please? There we go. Okay, so getting to phase one, yeah, I kind of put that one in gray because it is something that we have, but it's not currently on a real-time basis. We do it in conjunction with our coordinated access process through a weekly systems capacity report. So it would be only for programs that actually tie into the coordinated access process as opposed to the entire community. So I thought I would share our experience with at least getting to this phase for any communities that are interested in this kind of a process. What we did is we actually had dedicated staff capacity because it is a pretty large undertaking at first. So we actually had a temporary contract staff that was one of her sole responsibilities, was to do this system map. So you do need someone who's not afraid to pick up the phone, not afraid to fish around. And you need someone also with attention for detail, because to echo Marty's point, like, it's not just like you're dealing with the same people who, you know, the same community organizations who are dealing with people experiencing homelessness. You're also dealing with systems that are kind of outside of the homeless serving system, such as the public libraries, where there is a lot of intersection. So we wanted to make sure that we really got all of those, but it did require actually reaching out, not being afraid to pick up that phone and contact people. Now, clear. Yeah, and then clear eligibility criteria really allows people to get the service where it is best for them, where it is safe for them, where it is appropriate for them. Okay, and then we'll move on to the next slide, please. So getting to phase two. Actually, would you mind clicking again? There should be a box there. There we go. All right, so in order to move on to this phase, this is where we would operate the full-time, the robust real-time occupancy report, which wouldn't just be on a weekly basis, but would be linked with our HMIS and the other tools that we have that allow us to access real-time data, as well as a feedback loop, of course. We're looking at performance indicators. I'm going to talk about these two together because, of course, we really need feedback from clients and staff. We really need information on program evolution in terms of where they are on the Housing First fidelity spectrum. Of course, not all services, not all programs need to be on the high end of this spectrum, but of course, you need to have enough organizations that are on different places on the spectrum to be able to meet the needs of the clients that we serve as a community, as well as the acuity mix and funding types. So how is that changing over time? How can funding resources be allocated to best meet the needs of the people that we serve and to fill in any gaps for people that are currently being underserved or unserved? And ongoing data collection, which of course, one of the main metrics there would be the percent of occupancy, but also in terms of, are they able to deliver on their outcomes? And our litmus test for a lot of our programs, of course, is housing stability, because that's what it really drills down to. That's what it really drills down to, is that housing stability. So we're really looking at integrating with HMIS. We currently have an initiative in Newfoundland and Labrador for HIFIS 4 pan-provincial implementation. So that'll allow us to collect the data and really figure out how we can deliver on these outcomes. As well, we're looking at ways that we can collect research on our programs and on our clients. And of course, one would be actually data, which would be able to collect through the HMIS. The other one would be primary research. We're really looking at getting more feedback from participants and staff themselves, as I mentioned. And we're actually doing that for the first time this year, actually directly reaching out to participants and asking about their experiences with Housing First programs, so we can get more input on how to better inform those programs. As well, this is something that's been really exciting for us, and it's based on the At Home Chez Soi study that took place in Canada. We're looking at specialized research to take specific subgroups of people that we serve and actually measure the impact that a Housing First intervention has had on them in terms of their system usage. So like in terms of the healthcare system, correction system, that kind of thing. So we're really looking at taking that data. It's difficult in a place like St. John's because it's hard to get kind of the big data. We're a small city, but certainly collecting all the data that we can and leveraging that for the purposes of our community, and how do we get better at that system mapping process and serving the needs of the people that we have. Now, I'm just going back over here. I want to make sure I don't miss anything. Okay. Nope, I think we're good there. All right, we'll move to the next slide. Like I said, I was taking notes during Alina's and Marty's presentation. Now I got a big mess made here, but anyways, we'll get through it. And if anyone has any questions, if there's anything I'm not clear on, feel free to ask at the end. Integrating with coordinated access. I mean, this is so critical to the system mapping process. This is really where, you know, the rubber hits the road. So how do people access services? How do the services interact with each other? We can look at things in terms of system mapping here, like, you know, location and times of day, just to make sure that all these things are, you know, people are receiving the services that they need at the right time and the right place. In terms of the by name list, we're looking at doing something really interesting in St. John's now. Before, we were just tracking people who actually screened into our coordinated access. And we weren't really doing anything in terms of data with the people that were diverted from our coordinated access. But of course, that information is really helpful to us, because if we're not screening people into coordinated access, we really want to see what services and what programs they're using after they've been diverted and able to meet their needs. So how can we bolster those programs and services so that they can access them more easily, and then we can, you know, keep coordinated access for the individuals that need it the most. As per Alina's point, you know, if you don't do a good job of that, you're really going to overwhelm your system. So we're really starting to track that now. I already mentioned the systems capacity report that we're updating weekly. The collective impact working group is something we do side by side with our weekly intake table meeting. And this is for cases that require a collaborative response on the part of the community. So this is really where you can see where your system planning comes in handy, because we really need to see what programs are out there and how they can work together to meet the needs of people who need more of a collaborative response. And also, sometimes more importantly, what services aren't out there and how we can really round them out. So in order to address that, we're in the process of forming a systems coordination table, which is a high-level systems table to identify and fill the gaps in these system responses. So a couple that we've identified so far, for instance, Newfoundland and Labrador doesn't have a managed alcohol program. So if we identify an individual that is really what their housing stability is hinging on, then we have to look at a way of getting them out of province, which of course requires pushing a lot of levers in order to get the funding and coordination to do that. We're also looking at a low barrier shelter. We have great shelters here in the system now, in our ecosystem now, but a lot of the time they're not able to serve the needs of all the individuals. That's one of the things that happens in a small town, as a lot of you would know, you know, it's easy to burn your bridges, because with a small number of service providers, you get known pretty quickly. So sometimes that happens and it creates barriers to individuals. And the final thing here would be a trusteeship program that is customized to the needs of individuals who can't manage their household income. Like, we've identified a pocket of individuals who are on the transition point from being an adult to being a senior. An adult being that they would receive, say, if they're on income support from the provincial government, and then when they become a senior, they would access their old age security. And a lot of the time, these individuals have their rent paid while they're on income support. But then once they transition to OAS, then they're expected to pay their own rent, because that's not part of that system. So how can we actually design a program to meet the needs of people in that community? So that's, you know, really using coordinated access and the people that we see on a regular basis in order to identify the pockets of needs that are not being met, and then to integrate them into our systems mapping exercise. All right. Yeah, and I think that's it for me. I think I got through all my notes here. So next slide, please. So thanks for listening, and by all means, I've put my contact information there. So if anyone wants to contact me directly, feel free by email. That's my cell phone, so call or text anytime. Thanks a lot, and I'll hand it over to David.
Thanks so much. First, a big thanks to Alina, Marty, and Jennifer. I too was scribbling away and capturing new pieces and new areas of thinking. And Also want to thank the attendees that are online. And looking at the count, there's over 120, and that reflects for me the importance of this work and where communities are looking to address the issue of homelessness, but also where they're looking to address the gaps within their system. And so appreciate you being here today. Next slide, please. The examples that Marty and Jennifer and Alina identified, really do reflect the need for holistic approaches to homelessness that think beyond the homelessness sector. And in order to prevent homelessness or respond in general, those on the outside of what would be considered the homeless sector, so what we've talked about already, do need to play a role. And these examples also reflect the kind of flexibility that exists within a community. These adaptations to working outside the box and forgetting that, we've always done it this way kind of thinking, and designing a system around individuals is what makes the system planning work and system mapping so important. The mapping of services, directly aligns with the importance of dedicated and targeted plans to address homelessness. And I'm sure Alina would agree that, this is a piece of work that is fundamental, the foundation of a plan that seeks to address homelessness. And, those plans to address homelessness should really only be three things. And that's to validate good work happening in the community. Two examples here. Set a clear direction for what shifts are required for that community, and then also, really give permission for communities to innovate. And we also heard, the importance of hearing from individuals with lived experience, the ones on the ground, navigating that maze of services, running into roadblocks, running into misguided information. It really is incumbent upon the sector to redesign itself so those who need services can redesign their future. Next slide, please. Many would argue that a broader plan, be that a community plan or a regional plan or provincial plan, is required to influence change. And I actually fundamentally disagree. I think many community, regional, or provincial plans have been the catalyst behind the development of those plans, or those sort of the community innovation at the regional or provincial level have been the catalyst behind why community and regional and provincial plans need to be developed. So that's why it's super important to track your progress and engage government as you develop those solutions. There's often this argument or this conversation around, you need evidence to be able to argue that you need a plan. And I would disagree with that as well. And that in lots of ways, we need examples of how to innovate in order for a piece of policy to find the right secure footing in communities and in provinces and territories. Government is always in the policy development cycle. It's not a beginning and an end. The hub of that cycle, that stakeholder engagement and education component, is always turned on. And the community plays a really critically important role in feeding and influencing that element of the policy cycle. Bring them into your work if you can, engage them in those solutions and work with them to overcome their own barriers. Because together, this innovation, these examples can work to overcome those large barriers that exist across social and public systems. Next slide, please. First, I'll apologize to Marty because this is probably a outdated centralized access diagram. And if it is, I'm sorry. And if it's changed, my guess it's become more refined and more focused. But, that being said, you'll see that across that centralized access work in Lethbridge, which nests in Lethbridge's homelessness priorities, aligns with the work and the strategies identified in Alberta's broad 10-year plan to end homelessness. And that's sort of that validation that I was speaking about. Now, Lethbridge has been on this innovation phase for a long time and in lots of ways influenced these elements that existed within the 10-year plan when it was developed. And, this is the example that we want to see in communities that drive this big community and provincial or territorial change, and how systems can work together and how systems can be woven together to best serve the clients. And the Alberta 10-year plan was really built around the innovation in communities in Alberta and their expressed need for broader policy that could support their own innovation. Next slide, please. So if you're pursuing system planning or mapping and maybe you're at the beginning stages, there's some important pieces and steps that you can take as a community. We've talked and we've heard about it all in across the presentations. One of them being demographic data and aligning demographic data. And that's, I put this on the list first because it's the most work and it's super challenging. It's cumbersome and it's sticky, but it's necessary for us to streamline approaches. And those streamlined approaches then become highly integrated because you're speaking from the same language, which opens up doors for data sharing. And, that no wrong door approach, which is in Lethbridge, is so important when assessing your community's ability to respond to clients efficiently and respectfully. Having data sharing complement that work is super critical. You also need to be employing a strength-based assessment process and a tool that can delineate between, an individual's long-term risk of homelessness and their short-term risk of homelessness. And these distinctions can support the mapping process for an individual, or how an individual can be triaged or supported within that bigger system. And again, this is keeping in mind all those arrows that are pointing into our homelessness sector. And this goes without saying, but adopting a collective impact approach in your community, if you haven't already, is key. Collective impact is the commitment of a group of actors from different sectors to a common agenda for solving specific problems. And we've seen examples of it across Canada, and we've seen how well that collective impact approach has worked in communities. Next slide, please. So I'm not going to suggest that every province needs a dedicated plan or strategy to address homelessness, but I will suggest that government should be prioritizing integration and narrowing the gaps between policy and programs that are complicating one's homeless experience. This is we've heard, you had seen examples. This isn't a one department issue. This isn't a housing issue, but definitely government should be working to align themselves, align with the Canadian definition on homelessness and the youth definition on homelessness from the Canadian Observatory on Homelessness. And from there, working across departments to develop a deeper understanding of where they all fit within that continuum, keeping in mind a focus on prevention of homelessness and sustained exits from homelessness, as well as access to housing, are super critical. Next slide. System change is tough. It's really tough. And system change across government and influence system change within government is really tough. I've experienced it firsthand. Government should be engaged in the ongoing review of current system barriers, and we know what they are. We have got lots of research and lots of evidence to understand what those barriers are, and we also have examples of how systems and those barriers have been overcome by communities. And so government and ourselves can't suggest any longer that we don't know what those barriers are, because we've got really good examples for them. And this doesn't mean that we're reworking all these systems and grinding them to a halt and building them back up. But as communities are working to align themselves, government should be as well. What we're going to land on, and Marty and Jennifer are really good examples, is that we're going to land on these really high functioning communities that are super efficient, aligned and integrated, but they're then having to wedge themselves into the misaligned government systems. And that becomes a real barrier for that community momentum, for that community to continue to drive towards improved outcomes for individuals in their communities. And so, there are key players. Alina spoke to it. Marty and Jennifer both spoke to it, key players and departments in this work. And, as a collective, as a system planning collective, we're really keen to support communities and provinces through that process. The System Planning Collective is a capacity building and technical assistance body that is dedicated to supporting communities in efforts to prevent and end all forms of homelessness. System planning, using that housing first as guiding philosophy as a method of organizing and delivering these services, housing programs that coordinate diverse resources and ensure that, again, we can achieve the best outcomes for individuals experiencing homelessness or at risk of homelessness. And so in closing, building efficient, streamlined, and comprehensive systems should be a priority for all of us. Thank you.
Okay, thank you so much to all of our presenters for that great discussion of system mapping. We're going to now check in with the audience and see if anybody has any questions for any of the presenters. If you have a question and you haven't typed it into the box, now is a good time to do that, and then we can forward the question along to the presenters and have them answer as appropriate. Is there any final remarks that any of the presenters have after hearing everybody else say their piece?
I'm just so impressed. Like, I've learned so much myself. So thank you to my co-presenters. It's an evolving field, and it just shows you how important these webinars are to keep the knowledge moving. And so I'm guessing there's lots of people on the webinar that similarly are doing very exciting work. So, you might not have a question, but even if you have a kind of a point to make of what's happening in your community along these lines, this is a great platform to share about that.
All right. Okay. So we have a question from Diane, and she says, do you have any experience in trying to coordinate services provided by faith-based groups? I find they seem to be quite territorial and not necessarily open to coordinating with other groups, leading to a lot of overlapping services.
Mm-hmm. It's Marty here. I can take a stab at that because I'm living that right now. And so we've got a number of faith groups that are, they're very passionate. They have good resources and they all want to help. But you're right, I'm finding, and I've known for years, that sometimes they can be a bit territorial. But if you can corral that passion, boy, you can do some great things. So what we're doing in Lethbridge is we have a number of large projects we're trying to get off the ground. And I have engaged the different groups using the strategic planning and the help seeker social asset mapping tool as kind of a segue, and just explaining to them about what the needs are and what if we could do this together. And so ironically, we have a meeting coming up where we have virtually all of the different faith groups in Lethbridge coming together in the vision, if we all agree to the same vision, which is helping address the social issues in Lethbridge, and we can pool our resources, we can really multiply the outcomes that we generate. And so I must be honest, it'll be interesting to see how that initial meeting goes, but so far, the groups are all coming to the table and saying, yeah, you know what, that makes sense. And I will definitely keep folks updated, but it's so far, it's working.
Great, thanks, Marty. Does anybody else want to jump in?
I know that Kelowna is working on kind of mapping the resources in their faith sector. So I'm not sure if there's anybody from Kelowna that wants to jump in on that one. But same thing with that Marty says, and around territoriality, I would say it's actually not just the faith sector that has that issue. So I think it's just extending the same courtesy to all providers that are in your network, and you have to go with where there's willingness to collaborate a little bit. So like we were saying, just eating the elephant one bite at a time. It might make sense to play with the ones that are more open, and then getting them to open the doors to the broader network. There might be an ecumenical type of council where you can get the leaders of all the churches on board. So they have different decision-making structures than we might in the nonprofit sector. So you have to figure out what that is, because at the service provider or our equivalent of service provider level, there might not be willingness, but at the big picture strategic level, there you might get some buy-in. So you might just need to look at it from a GR perspective and see if you can tap the decision makers through personal relationships and building trust at different levels within their organization. So it's just like anything else. We just need to put in the work to make it happen, but we have to, because they are such a major player. Whether we integrate with them or not, they are doing the work. So it's in our best interest to build those bridges with them.
Thanks, Alina. So I'm going to move on to the next question if nobody else has anything else to add. And the next question is from Michelle Henderson, and she asks, how is value stream mapping different than system mapping?
Okay, so value stream mapping, and if I'm going to probably mess this up, and Marty, you might have better background in this than I do, so please correct me. Value stream is around when you do a product development and you bring it to market, and there's various stages in that process, and every stage should be bringing value to it. In market terms, that's monetary. So the marketing and branding of that asset brings additional value, so that when you put it on the market, it's now worth more than it would have without the branding, for instance. So you're mapping the value at various stages in the product's development. So that's how I understand that. System mapping is about the resources and how they interconnect and play together, or don't play together, articulate towards common community objectives. So obviously there's some relationship there to your point, but I would say fundamentally we can't really have equivalency of our systems to factory or a product development stream. So it's not going to be as good of an analogy to use that. It's quite a bit more complicated, because we don't have a clear production line in terms of the services that we currently have. So it's really that trying to make sense of what you've got versus taking the product from research and development and into the marketplace. So I'd say that's how it's different. But now, can that field add value to understanding? Absolutely. And I talked about the funding models and what value and outcomes we can actually gather from analyzing all of this work. And we can do that type of analysis that you're referencing, but we can only do that if we know what we've got, what we're actually analyzing. So I'd say it's kind of the precursor to be able to even say what value is being brought at what stage towards the common objective. It's quite a bit more basic than what you're referencing, but still along the same lines.
So Marty here, and I'll just add to that a bit. That was a beautiful explanation. It was perfect, and mine's going to be much simpler and I guess basic from the perspective that, as we're doing our social asset mapping and integration, realistically, I have to be honest, I'm looking at those social assets and putting a value on them. Maybe that's wrong, but I'm looking at some groups that, right now, their asset value as an organization may be very, very small, and that doesn't mean it has to remain there. But I'm looking at other social assets. I'm looking at two church groups right now. One is looking at, leveraging in the millions of dollars of resources, and another church group is just getting started out, and they're just kind of creating a group right now to even look at this. Well, from a value perspective, yeah, there is obviously a tremendous value in the one organization compared to the other. But from a system integration perspective, I still want to map them all. I still want to know what you're doing. I still want to know where you are, on that tree. And so, because every dollar counts. And then another unique thing that's happening is that because we're starting to get this collaboration, we're starting to reduce the amount of duplicate grants. A grant comes out from the different levels of government, we all scramble to apply. Well, we've just completed about 4 grants here in the last month where it was really a system integration where we had a group of nonprofits apply together and collaborate to submit the grant instead of each one of them applying individually. So we can put a name or a definition on some of these processes, but ultimately, I always try and look at it from what's happening in that real world and how can we leverage. And I guess if someone wants to put a title on it, that's great, but it's often not, it's muddy.
Thanks, Marty. So I'm just looking through the questions. We've got about 20 questions in here, maybe a little bit more, and we've got 15 minutes. So we're going to try and get through as many of these as possible. So the next question comes from FaZe Samji, and the question is, do you know of any public data sets that we can use to analyze trends?
Well, you guys, if you have 2-on-1 in your community, you can ask for that data. That might exist already to help you get started. Yeah, so we had trouble with this because that's how we ended up having to kind of do the system mapping work, because we found that there wasn't really one thing that united all of these assets, right? So for instance, there's some resource guides that only include government services, others that only include nonprofits. There might be something that kind of includes some faith-based, right? So we found that there wasn't really anything. That's why we had to do this community engagement work like Marty described. So, however, there might be these bits and pieces you can cobble together if you want to kind of shortcut to have something to start out with. So I'd say start with what you have and then have that as your baseline and then grow from there. So, yeah. I don't know if anybody else has any ideas.
Jennifer here from In Homelessness St. John's. I don't know if this is helpful at all, but I do know that there are a few free webinars coming up through Statistics Canada, and I made a note of the programs so that I could dive into them a little deeper myself. So I wish I had actually done that before this panel, now that I think about it. But I can give you the names of the Statistics Canada programs that might provide what you're asking for. The names are GeoSuite, GeoSearch, and Beyond 2020. So that might be a good starting point, but I won't really know until I dig into them. So if anyone else has any info on them, maybe you can share it in the comments.
Mm-hmm. Marty here, and I just want to put in a plug on where we could go with this. So right now, there's a lot of data and information out there, a lot of big data. I mean, there's a lot of different mediums to get it from. But we really, again, we don't have that kind of one-stop shop platform, tool, database where we can get the information, analyze it, or even simply a portal where we can collect it and make sense of it, bring nuance to it. And so that's what, I see such value in tools like HelpSeeker, because eventually this will grow and become more and more robust and more powerful. And then ultimately it could be that one-stop shopping place where we can go to it and not only get the information we need, but even pose the questions and make them come up with the answer.
Great, thanks, Marty. So I'm going to move on to the next question. It's from Robert Feldman. And the question is, how accurate is the day-to-day inventory of available beds? We find it very difficult to have providers update their inventory data on a daily basis.
Well, I can take a stab at this, and just to say like that we, and Marty mentioned this too, that we just built the platform, so we haven't put it into use yet. Our first step was to do the mapping, and we're only about 40% through the mapping phase, so that we can then move to the real-time occupancy report. So it's really going to be as good as your providers see value out of it. So it needs to be something that's really user friendly. So if you build something yourself, like emailing or updating on a irregular basis is not going to work. They need to see this as an important piece of the puzzle, and they need to be held accountable to keep the occupancy in real time. Otherwise, people in your system will keep going to facilities that have been full for months. So, and then they get frustrated and give you the negative feedback that they got the runaround. So it's incumbent on the providers to keep that information up to speed. And what kind of incentives can we put in place? How can we make it really easy to do? How can we hold ourselves accountable to ensure the information is updated in real time? That's the trick of engagement and getting buy-in from all of the providers. But then it's also reinforcing it, unfortunately, in your contract agreements as well, that it's part of their KPIs that you're monitoring, is to ensure that there's publicly available real-time information on program occupancy. And you're not asking them to release any like private information. You're just saying how many beds or caseload capacity do you have, and how much of it do you have available? Like that's not asking a lot. So it's the minimum we can do so that we reduce the runaround for clients asking for help all over your system and getting the door shut in their face because those doors are bursting already. So I don't know if somebody else has ideas about that.
Yeah, Jennifer, I'll jump in here. Yeah, I think this is really where a really robust homeless management information system, HMIS, can come into play, because I think like this, in the conversations that we've had, occupancy is not necessarily a static state. And sometimes like we're talking about, a double bed that would be able to accommodate a couple. But if that double bed is assigned to a single person, I mean, it's not like you're going to throw someone in with them. So it's not, the same as a hotel or something where you're allocating rooms. You're literally allocating beds, but your occupancy or capacity might not be a static state. And I think that's where some of our service providers have kind of struggled, like where you have situations like that, or where certain rooms or beds go offline for maintenance, that type of thing. So I really feel like the best answer to that is an HMIS that allows each and every shelter to kind of, customize it to meet its own circumstances if it has beds like that, where both the occupancy and the overall capacity are able to be responsive to the circumstances in the shelter at that period of time.
Great. Thanks, Lena. Thanks, Jennifer. The next question is about the help seeker. There's two questions, one from Trina F and one from Renee T. I'm going to just loop them into one question. So the first part is, how, if at all, does help seeker coordinate/work with 211? And the second part from Renee is, does a tool like help seeker also allow you to track and analyze the category of services that are being sought out by users? I could see this information being very helpful to funders to inform where there is a greater need for investment.
Mm-hmm. Yeah, so the latter one, does it track the search categories? Yes. And the question about 211 integration, 211's been interesting because it's actually every region has their own 211, so that there's not like this national 211 that we can just say, hey, let's integrate. The way the Alberta one works and is set up in the database is very different than the Saskatchewan works, and Ontario, etc. So we would need to create platforms for every province that it exists in, or region, because sometimes it's regional. So we kind of have to approach everybody one by one. So our approach to the Alberta one was to ask for integration of the data. Now the challenge is that when we looked at the data that we generated in Help Seeker, it's about double what they have in their database. So now we're saying, well, do we really want the data at this point, or do we just use the one we have and then have them plug in what's missing in our database, or is there an opportunity to kind of cross-reference each other so that we both have more complete data sets? Like clearly there's stuff missing right now in those databases, and so we want to make sure that we have the most recent, most up-to-date, and most comprehensive listings that we can get. So we're pursuing every available database out there to integrate them all into Help Seeker, and 211 is one of them. But there's a whole lot more resource listings in operation across the country, and there's ones that are actually in areas that, for example, 211 doesn't cover. So Lethbridge is a great example. Medicine Hat was another example where 211 coverage wasn't really happening. So in those spaces, you need to start from a very different level. So I'd say it depends how good the listings are, but 211 is just another listing in your community. And if they're willing to share, which is another major challenge too, is like not everybody wants to share their data. So then we have to start like, begging for data sharing and open resources and all of that. So yeah, I'd say it depends on your players locally and how willing they are to open up their data sets to this kind of system. But there's definitely tons of opportunities to get a better data set for your purposes if you look at across these different sources in your community and bring them all together.
Great, thanks, Alina. So there's about 5 minutes left or 4 minutes left. I'm going to ask a couple more questions, and then what I'm thinking is if we didn't get to your question, we'll include the contact information, if that's okay with the presenters, in the link to the recording that we're going to be sending to everybody of the webinar, and you can ask your questions directly to the presenters at that point in time. Does that work for everybody? Presenters?
Yes.
Yeah, that's fine.
Okay, great. So the next question is specifically to Marty. It's from Diane G. As a municipally initiated mapping process, do you find that provincial and federal programs shift their programs if there is a duplication or if there are gaps identified?
So good question, but you know what? We're not there yet. Of course, we're kind of knee deep in the mud right now on the process, but initial indications are yes, that they're very interested. We're specifically, we've connected with both the provincial and federal reps from a homelessness perspective, and I've included them in the conversations, again, of what we're doing and where some of the initial gaps, and they are listening. In fact, we're awaiting, hopefully, an announcement where we can address one of the key gaps we have identified based on this work that we're doing. So, it's always a challenge connecting the different levels of government. We all know that. But I'm finding there is a willingness to listen. It's having the data, having the evidence, and the ability to show them that is so powerful, because then it becomes a defined, not only a problem, but some solutions that come with it. And so I know that really didn't answer the question in great detail, again, because we're working through the problem as we speak, but so far it has been very promising.
Great, thanks, Marty. So I'm going to ask one more question, and this one comes from Janelle B, and it's for all of the presenters. She asks, when is the best time for system planning to happen? Should it be done before the community plan or as part of the community planning process?
Oh, I don't even know the answer to that question. As long as you do it at some point, Marty.
Yeah, this is Dave. Again, as I said in my slides, I don't think necessarily the one needs to happen before the other. I think at the end of the day, if they can be aligned, and they could be, working towards the same goal, great. I find that oftentimes, and we've got lots of examples where community innovation and community planning has informed broader solutions to issues, social issues. And I won't just say homelessness, but that innovation, the flexibility and nimbleness of communities really reflects nicely on how those other broader systems could be adjusted and changed. So I would say go for it, and then build your community plan around those elements as well.
And yeah, to add to that, I wish hindsight's 2020. I mean, I wish we could have all the answers and predict this is how it will happen. One of the best pieces of advice I was given years ago was, if you don't jump in the cold lake and get your feet wet, 3 years from now we're going to have the same question. So it's almost one of those, go for it, and you'll have questions, you'll make mistakes, but ultimately at the end of the day, those mistakes, that going for it, is what creates innovation. Show me a person who's never made a mistake in their life, and I'll show you that same person who's never tried anything new.
Great advice.
Great. Okay. Well, thank you to all of the attendees for sending in your wonderful questions. We apologize for not having time to get to them all. Just to let everybody know, the webinar was recorded in its entirety, so you will be getting a link to the webinar recording within a week. And the contact information of all the presenters will also be in there, so that if your question wasn't answered, you can reach out to them directly. Is there anything else that any of the presenters would like to say as a final note? No? Okay. Thank you so much to Dr. Alina Turner, David French, Jennifer Tipple, and Marty Thompson for sharing your valuable insights. And we wish everybody a great day. Thanks so much.
Thank you.
Thanks, everybody.
Thank you.